Let's talk about the side effects of finasteride for hair loss. Finasteride is one of the most effective FDA-approved treatments for male pattern baldness, but many people have concerns about its potential side effects. In this video, we go over the scientifically documented side effects of finasteride, how common they are, and what the research says about long-term use. So let's look at how finasteride works. Finasteride, or FIN, is a 5-alpha reductase inhibitor, meaning it blocks the enzyme responsible for converting testosterone into dihydrotestosterone, or DHT. DHT is the main hormone linked to androgenetic alopecia, known commonly as male pattern baldness, because it causes hair follicles to shrink over time, leading to hair thinning and eventual hair loss. By reducing DHT levels by about 70%, finasteride helps prevent further hair loss and can even promote regrowth in some cases. However, since DHT plays a role in other bodily functions, reducing it can lead to side effects. Scientific studies have analyzed the prevalence of finasteride side effects, particularly in men using the standard 1 mg daily dose for hair loss. Sexual side effects. Some of the most discussed side effects of finasteride involve sexual function. According to a 2012 study published in the Journal of Sexual Medicine, the following side effects were reported in a small percentage of users. Reduced libido, or low sex drive. Erectile dysfunction. And decreased semen volume. A meta-analysis published in JAMA Dermatology in 2015 found that sexual side effects were reported in about 1 to 3% of men taking finasteride for hair loss. Most of these side effects were reversible once the medication was discontinued. However, some users report persistent sexual dysfunction even after stopping the medication, which leads to concerns about a condition known as Post-Finasteride Syndrome PFS. Post-Finasteride syndrome is a controversial condition where some individuals claim to experience persistent side effects after discontinuing FIN medication. These effects may include persistent erectile dysfunction, depression and mood changes, cognitive issues such as brain fog. A 2017 study in Peer Journal found that some individuals reported long-lasting effects, but there is still debate within the medical community about whether PFS is directly caused by finasteride or if other psychological factors play a role. Depression and anxiety. There is some evidence that finasteride may affect mental health in a small percentage of users. A 2017 study published in JAMA Dermatology analyzed over 9,000 men using finasteride and found a slight increase in the risk of depression and negative thoughts, particularly in younger users. However, this side effect remains rare, and researchers believe that hormonal changes due to DHT suppression may impact mood regulation in susceptible individuals. Gynecomastia and breast tissue tenderness. Gynecomastia, or the growth of male breast tissue, is another potential side effect of finasteride. This happens because finasteride slightly alters the balance of testosterone and estrogen levels, leading to an increased risk of breast tissue enlargement in rare cases. A 2016 study in the British Journal of Dermatology found that gynecomastia occurred in less than 1% of men taking finasteride. If caught early, this condition is reversible by stopping the medication. Testicular pain. Some men report mild testicular pain when taking finasteride. This is considered a rare side effect and is not well understood, but it may be linked to hormonal shifts caused by DHT suppression. So, are finasteride side effects permanent? Most clinical studies indicate that the majority of finasteride side effects resolve after stopping the medication. The 2012 study in the Journal of Sexual Medicine noted that about 80 to 90% of men who experienced side effects saw them go away after discontinuing finasteride. However, in rare cases, some individuals report persistent side effects, particularly related to sexual function and mood. This is why it is important to monitor how your body reacts to the medication and speak with a healthcare provider if you experience any concerning symptoms. How to reduce the risk of side effects. If you are concerned about finasteride side effects but still want to use it for hair loss, there are a few strategies to minimize potential risks. Consider a lower dose. Some studies suggest that 0.5 mg or even 0.25 mg daily can still effectively lower DHT while reducing the risk of side effects. Using topical finasteride may be a better alternative. Some research indicates that topical finasteride may deliver similar hair growth benefits with fewer systemic side effects. Monitor symptoms. If you notice any side effects, consult a doctor to adjust your dosage or consider alternative treatments. Finasteride is an effective treatment for hair loss, with numerous studies backing its ability to reduce DHT and slow down hair thinning. While side effects are possible, they are generally rare and reversible in most cases. If you are considering taking finasteride, discuss the risks and benefits with a healthcare provider to determine if it is the right choice for you. Have you experienced any side effects from finasteride? Let us know in the comments below. If you found this information helpful, be sure to like and subscribe for more science-backed hair loss treatments and tips. Be sure to watch the playlist for more scalp and hair growth advice.